Hey guys, it's Dr. Emer. We're doing a great filming today of a male gladiator makeover, 6-pack, defined chest, defined arms, and we're going to use fat to sculpt out his shoulders and his chest. He's already athletic. He's going to be even more defined. Our plastic surgeon's going to fix his hernia, so stay tuned for that, little out-pocketing in his stomach, and also lift his chest and tighten the nipple area, removing the gland tissue. A lot of men get that. We want a sculpted look in the chest, so we're going to remove that. So we're putting in the tumescent fluid right now, which is the area that's going to help us remove the fat. This is fluid that's going to fill the area, lift everything up so that we can remove the fat safely and use it for chest injection. On this side, we're going to do it on his shoulders because we're going to be working on his arms. So we're putting fluid now into the arm so we can lift the arm and show the bicep. This fluid is the tumescent that's going to numb him, but he's asleep, so the goal is to get the numbing solution in here that has medication to stop the bruising and swelling. So now we're using the Vaser device. He's very thin, and so a lot of guys that are thin, they don't have a lot of deep fat. They have superficial fat, and that can cause irregularities if you don't use the Vaser. So now we're doing Vaser on the arm, and this is an area a lot of doctors don't do, especially the shoulder, because it's more dangerous. His triceps right here, his biceps over there, so we're gonna create a nice wedge here where it's going to be an irregularity that we have planned, so he looks way more sculpted. So now we're removing the fat that we vasored, and it comes out much easier, and someone especially so lean, we don't want to leave them with any indentation, so we're using a power assisted device to go in there and remove some fat. So let's see how much we get out. So now we're sculpting out the shoulder. You guys can see we're going to create a natural indentation, so it's going to look really athletic. We're doing the internal heating in the flanks. Most guys, this is a big problem area. So now we're going to put fat in the shoulder. You see this was taken from his back. Again, he didn't have too much, but there's enough now that we can get a nice little bulk. Give him a little bit more of that roundedness. He's super muscular, so this is really going to take a nice look to him and give him that more rounded, sculpted look. When someone's this lean, you need a good amount of tumescent to really get the ability to sculpt the area. So now we're doing Vaser on the front of his stomach, because this is the most important area. He wants sculpting. So we're gonna work to melt the superficial fat, really push it aside. The fat cells are safe for use in grafting. So now we're sculpting the chest, especially the borders of the chest. And you guys can see we're literally right on the bone, so you have to be really careful. I mean, you can see the cannula. He doesn't have much fat. Now we're sculpting out the abs. And again, remember, he doesn't have a lot of fat, so we really have to be careful about where we take it. Now we're doing Renuvion on the lower stomach. This is the internal heating portion. So that's going to be tightening the skin underneath. One of the great areas is this midline area. He really wants that upper chest defined, so we're going to build it out a little bit. And it doesn't look like it, but we've done a lot. Hey guys, it's Dr. Emer, and we're not even 24 hours post our patient's high-def gladiator makeover. You can see what he looked like before. In these cases, it's going to be truly very difficult to see how he looks now because he's going to be really swollen. You can actually see around here, we went really aggressive. That's why when I pinch, there's literally no fat here. We also removed a hernia. You could see it, a little hernia here. So any guys that have a little out-pocketing in their belly button, it may not be an outie, it may actually be a hernia. So we had to fix that. So to fix that, you have to go into the muscle and tie the muscle together, which makes it really swollen in the lower abs. You guys can see it's much more round up here. And then if I show you his shoulder, take a look at the cap of his shoulder. Much bigger and dense, and when I press, you can see there's a big indentation through here. So he is gonna look really good. He's gonna be sculpted, the V-taper. This will take us a few months to really see the results, but within a week, he's really gonna notice this a lot, especially the first 72 hours. It's gonna be super swollen, not much definition, and then all of a sudden it's gonna start to show. All right, so that's really it, day one. I like to show that because I know you guys like to see how the patients are. He has some hiccups here. This is usually from pain medications or anesthesia that'll go away in the next day or two, but that's it. Everything's healing really well, no complications that I see, and I'm super excited to see the end result. We'll show you maybe in 3 to 7 days from now how he looks. Bye, guys.